the one thing that I always tell people is make sure that you're doing everything that you can, but everything is being done right. There's a lot of times, and I've seen lots of veterinarians, not around here obviously, but you know, away from here, where they say, well, I've been doing this for 50 years, so you know, well, look at this. You can be doing everything that you think is right, but sometimes it's not. And look, you could end up with this kind of scenario. This cow is being bred at the right time. She's not going to get pregnant. It doesn't matter how good of it you are. So make sure you have confidence in the person that is doing the work. Well, so now that we got that part out of the way, then we're going to say, okay, well, let's say, you know, can we do something different with that mare? You know, many people are under the impression that, you know, we've tried everything and she's still not pregnant. Well, what was everything? Well, everything would have to include examining the mare at different intervals, use uterine contraction drugs, use anti-inflammatories, you know, aid in the fluid evacuation, change the breeding time, closer or further to ovulation depending on the semen, depending on the mare. Change the semen deposition site. You know, we might have to go deeper in the horn or reduce the number of sperm. You know, so all these things are very important, but make sure that the mare is clean. And that making sure that the mare is clean might need or might require the need to implement different diagnostic techniques. So this is a normal uterus. This is an abnormal uterus. You see the difference in, you know, this sort of, you know, I don't know what to call it, but, you know, it just doesn't look happy. Here it looks happy. This is the round thing, you know. Now, do you ever thought that I would know what a happy uterus was? Well, this is what a happy uterus looks like. This is what an unhappy uterus looks like. So, you know, these are things that, you know, we might be able to detect when we check a mare. The problem with that is that we're not going to be able to detect this in about 60 or 70% of the times on one examination. We have to look at that mare maybe 2 or 3 times during that cycle. And as many of you know, and I've told you, that I think that a mare that is not in heat always looks fine. She looks great. But a mare that is in heat, the wheels fall off the bus. I mean, everything goes to hell in a handbasket. So, you know, that is the reason why we always want to look at those mares over a period of time and also when they're in heat. So, if we have a previous culture that was negative, no pregnancy, signs of inflammation, then we have to do one of 2 things. We either have to culture the uterine biopsy or do a low volume lavage and culture that fluid. So that means, you know, putting a little bit of fluid in the uterus, we swish it around, we recover that, we spin it down, we take, you know, a swab from that, and we culture that, you know, in the lab. Here's the difference between, and this is, once you have a negative swab, you know, negative regular or, you know, not regular, but, you know, conventional swab, the sensitivity of culturing from a biopsy is 0.82. What does that mean? It means that 82% of the times you're going to be able to find with certainty what that mare had in the uterus when you take a biopsy. In contrast to 34% of the times with just a regular swab. So, you know, this is a much more sensitive technique to be able to detect those mares that have a negative swab, but they're still not pregnant and something doesn't look right in the uterus. So a slight growth of bacteria in the uterus of the mare is normal. True or false, or depends on the type of bacteria. 33, 34, 35, 36, 37, 10, 9, 8. the uterus of the mare is normal. Well, almost half of you think that. The other 35%, so that means, let's see, 83% of you think that bacteria in the uterus is normal at some point. Well, I'm sorry to tell you that all of you are wrong. And here's the deal. So most people would say in negative culture, you know, only slight growth of some strange bacteria is a probable contaminant. And that is a constant fight that I have with the darn labs around here. They'll write something, you know, I got one time a mare that says alkalogenesis, which I don't know what the heck that, you know, bacteria is, but alkalogenesis fecalis. Hell is it? Well, I decided to not pay attention to the first name of the bacteria. Alkalogenesis didn't tell me anything. But fecalis told me there is some shit in the uterus. You know, so the culture technique and the hygiene of the procedure will determine the validity of the result. Yeah, of course, if you don't wash the mare and you go in, you know, wrap your hand in there, you know, touch everything around the mare and all this kind of stuff, you know, then, you know, it's probably not a reliable culture. The type of organism does not determine if it is a contaminant or not. If it's in the uterus, it should not be there. Nothing should grow in the uterus. So, you know, and if it's there, it should be treated. So now what happens with these mares that don't get treated? Well, you know, we have all these mares that, you know, have a bacterial endometritis, and now you end up with this chronic bacterial problem. So now it's not an acute thing, but it's a chronic thing, and it depends on the conformation of the mare, the cervical, you know, the incompetence of the cervix, mares that are not treated properly, or poor uterine tone, where the mare has a saggy uterus, and, you know, it doesn't evacuate all the fluid after insemination. Well, this is what happens with these mares, and, you know, this is why we need to take a biopsy. Look at this thing. This is a mare that, you know, is a tilted bald one, and they developed something called a biofilm. And biofilm, you know, for those of you that are in the medical industry will know that, you know, we, as humans, for example, have biofilms in our mouth. And that's why we, you know, when we spit, we don't have, you know, pus coming out of the, you know, mouth all the time, you know, even though there's a lot of bacteria in the mouth. And what happens is that these bacteria will hide underneath a cellophane film, if you will. And that cellophane film is right here. This is an endometrial biopsy. This is the lumen of the uterus, or the, you know, the superficial area of the uterus, and this is the deep part of the uterus. So you see that, you know, they have this mucus here. This mucus is the one that is hiding the bacteria. So the bacteria are hiding underneath here. So when you take a swab and you go and swab here, you're touching this mucus. Well, that mucus doesn't have any bacteria. The bacteria are hiding here. So what we need to do is go and take a chunk out of this thing and send that to the lab, and then we can get a reliable culture on that mare. So if we don't do any of that kind of stuff, what happens is that mare, that uterus, is going to start aging. And this is what happens. Look. Let's see if we have, you know, this. Oh. Well, that didn't work, but this is Clint Eastwood's the good, the bad, and the ugly. And this is what happens with these, you know, I had a little sound effect on this thing, but it didn't work, so it's okay. The good, the bad, and the ugly. So this is a normal uterus, this is, you know, not so good, and then look at what happens here. All these are glands of the uterus, and those glands are the ones that nourish the pregnancy while, you know, when the mare is pregnant. Well, you have all these things here, all this junk stuff here, you know, it's not going to be a happy environment for that, you know. This is the mare, this is the baby that lives in the suburbs. This is the one in the slums. And the one in the slums is not going to be a happy camper if they know what the suburbs